A quad screen is an optional screening test that is typically available between 14 and 21 weeks in pregnancy. This screening test was developed to identify women whose pregnancies are at increased risk for certain birth defects or genetic conditions. A screening test like the quad screen cannot tell for sure if a baby has these conditions. It can help you and your healthcare provider know if additional testing should be offered. A quad screen should be offered in any pregnancy unless first trimester screening for similar concerns has already been completed. This presentation will help you decide if the quad screen is right for you and your family. A quad screen provides information on a group of birth defects called neural tube defects and two genetic conditions called trisomy 18 and trisomy 21. The most common of these is trisomy 21, which is also called Down syndrome. Most people are familiar with Down syndrome, which causes mental retardation and sometimes other health problems such as heart defects. Some individuals with Down syndrome are more mildly affected than others. Even though trisomy 18 is less common than Down syndrome, babies with this condition usually have many birth defects, growth problems, and mental retardation. Most, but not all, babies with trisomy 18 pass away during pregnancy or shortly after birth. The quad screen also provides information about neural tube defects, which are problems with the development of the baby's spine and/or brain. The most common neural tube defect is spina bifida, which means that the baby's spinal column did not close properly during the early part of the pregnancy. This happens in about 1 out of 1,000 pregnancies. Individuals with spina bifida can have difficulty walking as well as other health concerns. Spina bifida is quite variable and can range from mild to severe in different children. In every pregnancy, there is a possibility that the baby could have one of these birth defects or genetic conditions. Most babies who are born with these conditions do not have a family history of similar concerns. A quad screen can tell you whether there is a higher or lower chance that the baby is affected. However, since this is not a diagnostic test, the results cannot tell you definitely whether or not the baby has one of these conditions. The quad screen is most often completed between 14 and 21 weeks in pregnancy. This screening test combines blood drawn from mom's arm with other information on the pregnancy. 4 hormones in mom's blood are measured in a laboratory to look for patterns that may be concerning. The laboratory also uses other information, including the mother's age, weight, race, certain family history, how far along mom is in pregnancy, and whether there are 1 or more babies to calculate the result. The quad screen result calculates a risk or chance that baby may have Down syndrome, trisomy 18, or spina bifida. Babies with these conditions often show certain abnormally high or low patterns of these hormones. The quad screen detects approximately 70% of babies with Down syndrome, approximately 75% of babies with trisomy 18, and approximately 80% of babies with open spina bifida. It is also important to know that abnormally high or low patterns of these hormones can be seen with healthy babies or other less common birth defects or genetic conditions. More testing may be necessary to further evaluate the pregnancy. Results are typically available in about a week. If the quad screen result is negative, the baby is at a lower risk for Down syndrome, trisomy 18, and spina bifida. After a negative or lower risk result, you will most likely be offered an ultrasound around 20 weeks to evaluate baby's growth and to look for general birth defects that the quad screen cannot detect. It is important to know that a negative result cannot completely rule out the possibility that baby may have one of these conditions. If the quad screen result is positive, the baby has an increased or higher risk for 1 or more of these conditions. A positive result does not tell us that a baby has one of these conditions for sure. Approximately 5%, or 1 in 20 women who have a quad screen, receive a positive result. After a positive result, a healthcare provider typically discusses the result and the additional recommendations, including ultrasound and the option of a test called amniocentesis. If a genetic counselor is available in your area, your healthcare provider may recommend meeting with him or her before your ultrasound. A genetic counselor provides a detailed discussion about the quad screen result and how ultrasound can help provide more information. They also discuss the option of amniocentesis, since this test is the only way during pregnancy to know for sure whether a baby does or does not have Down syndrome or trisomy 18. The combination of ultrasound and amniocentesis can identify approximately 95% of babies with spina bifida as well. An amniocentesis is a procedure during which a fine needle is inserted through the abdomen and into the uterus to collect a small amount of fluid from around the baby. The fluid contains skin cells which are tested for chromosome differences such as trisomy 18 and Down syndrome. Amniocentesis is a diagnostic test which gives a definite yes or no answer about these two conditions. It can also look for a limited number of other genetic conditions. Amniocentesis can cause mild discomfort as well as a risk for complications. About 1 in 600 women will have a complication after amniocentesis that may lead to miscarriage. Usually, only those pregnancies at high risk for certain concerns are offered the option of an amniocentesis. As mentioned above, the quad screen is entirely optional. When considering the quad screen, you should think about what you would do with the result that comes back with the low or high risk for these conditions. You should also consider whether you would find it important to know if your baby has Down syndrome, trisomy 18, or spina bifida during pregnancy.
I knew I would never consider terminating my pregnancy, so I decided to take the quad screen so that way I would know ahead of time and be prepared if my baby was going to have special needs. I didn't want to get a shock when he or she was born. I felt like the more information I had, the better.
I decided to have the quad screen because I was considering ending the pregnancy if I found out the baby had a severe developmental problem. I felt like I just couldn't take care of a child with special needs.
I felt like the quad screen wouldn't change anything for me, and it would just cause me to worry if the results showed a high risk to have a baby with the problem. I decided not to have the quad screen at all and just wait and see.
Remember that the decision to have the quad screen is entirely up to you, but it can only be done during a specific time during your pregnancy. Feel free to ask questions and discuss the quad screen with your provider before making the decision that is best for you.